Okay, well, a warm welcome to our new webinar series, What the COVID-19 Pandemic Means for Refugees. If you are a participant, you'll notice you are on mute. We've muted everybody until that the Q&A at the end. We're also recording this, so please be aware that it's being recorded so that people who are not able to listen synchronously will be able to listen to a recorded version later on. So for those of you who don't know me, I'm Galia Benarie, and this series is part of the new Colloquium on Refugees, Migrants, and Statelessness. The Colloquium is one of the working groups within our new Northwestern Weinberg College Center for International and Area Studies. The Colloquium is the new generation of the Center for Forced Migration Studies, for those of you who knew about the Center for Forced Migration Studies. And we work to broaden our understandings of the realities of refugee flows, asylum seekers, conditions of statelessness, internally displaced peoples, and development climate-induced migration. This webinar series could not have been possible without the work of Danny Postel, who's the Assistant Director of the new International and Area Studies, and Cindy Pingree, who's one of our key administrators in that program. And both of them kindly, immediately, with everything else going on in their lives, said yes when I raised the idea, and quickly mobilized along with my other colleagues, Denise, who you'll hear from shortly, my co-host, and Rana, to take care of all the technical aspects that have enabled us to be here today. So, while those of us in the United States, in our homes alone or with loved ones, wish we didn't have to be participating in this global-wide stay-at-home order, millions of refugees around the globe have no home and live in crowded UNHCR or state-run refugee camps, detention centers, and makeshift urban tent cities. In crowded living conditions. For hundreds of thousands of others, hope of being reunited with family or being granted one of an increasing limited ticket to a life in a new country as a resettled refugee is now gone in the face of travel restrictions and closed borders. So through this series, our hope is to raise community awareness by bringing you speakers from the front lines, advocates, practitioners, and refugees who can fill you in on their situation. Next week, although you don't have to participate in all of them, maybe for you this is just a one-off and you're interested in this topic, but just to let you know, we have a number of series planned through the end of April and the start of May. So next week, we're going to hear about the continuing work of UNRWA and Palestinians in East Jerusalem with someone live from Jerusalem. The following week, we're going to focus on Chicago and our own Golden Door Coalition. The week after that, we're going to turn our attention to Canada and the situation of refugees in Toronto. And then the final webinar we have already planned for April is about refugees, and we also have some in the workings for May. But today, now let's turn our focus to today. Today, our Madi are going to talk about the situation of refugees generally and turn their focus to their expertise, which is on the situation of Syrian refugees in Greece and other sites, which they'll tell you about. Before introducing our speakers and turning the Zoom mic over to my co-host, Dennis, she's gonna say a few words about how you can join in chat as a participant. Go ahead.
Hi, everyone. Thank you for joining our webinar series of the Colloquium of Refugees, Migrants, and Statelessness. I am...
Denise,
yeah.
Can you hear me?
Yeah. Galia, okay, I'm going on with the introductions. Hi again, everyone. Thank you for joining our webinar series. I am a sociocultural anthropologist, and I work with migrant farm workers from the Kurdish region of Turkey and Syrian refugees.
Thank you, Denise.
Turkey and in Europe. At Northwestern, I'm the postdoctoral came on modern Turkish studies program.
Let's turn our attention now to Greece. What we're going to have today is, and I have to tell you, I had a little glitch. I can't hear.
So I think I will take over from here. Could you?
Sorry about
Talia?
that. Do this if it's my turn.
Could one of our co-hosts mute Galia, please? Okay, I think we are on. Back on. Okay. So I was introducing myself. I am the postdoctoral fellow of KEMA Modern Turkish Studies program housed under Buffett Institute for Global Affairs at Northwestern University. And I am the co-host of this webinar series. As you realized, we unfortunately have a technical issue with Galia. So I will be running the rest of the webinar. I am a social cultural anthropologist. I work with migrant farm workers from the Kurdish region of Turkey and with Syrian refugees in Turkey and in Europe. I am also the creator and host of the KEMA podcast, for which I conducted several interviews with scholars who work on migration and war with a specific focus on Turkey. So if you're interested in these issues, please also check out the KEMA podcast. And finally, I will be hosting the Q&A session and the Q&A session for this webinar. So please, if you have questions throughout the webinar, post it on the chat, and I will pose your questions to our speakers after I ask them the questions that Galia prepared for them. So let's go on with introducing our speakers. Lina Zahra is a Syrian-American social justice champion, elevating connections through innovative storytelling and strategic community building, a firm believer that we rise by lifting others. Lina actively spearheads opportunities that mobilize grassroots activism and membership engagement to uphold universal human rights for all through civic, regional, national, and international platforms. She received her master's degree in international development and humanitarian emergencies from LSE, London School of Economics, and obtained her BA in international studies at Miami University. Her focus is in humanitarian crisis and specialty in refugee and asylee protection. Recently, she received the 18 of the 9 award in 2018 from Miami University, which recognizes 18 outstanding alumni who have graduated in the last 9 years. Lina has worked with small to large scale foundations, NGOs, INGOs, and government agencies such as Karim Foundation, the International Rescue Committee, Syrian American Medical Society, World Food Program, and through the UN and the United States Senate. Lina grew up in Cleveland, Ohio, and currently resides in Chicago, Illinois. Welcome, Lina.
Hi, everyone. Thank you so much for being here with us. I want to say a special thank you to Danny, Cindy, Galia, and Denise, and everyone, and all the participants. I know you're most certainly flooded with information, alerts, memes, so it really means a lot for all of you to join us, so thank you. And I'm so lucky to be here with Madi. I don't know if you want to say a few words,
Let me go on with introducing Madi now. Madi Williamson is a registered nurse and career humanitarian and medical aid worker. She has spent the past 4 years volunteering in acute and post-acute humanitarian crisis zones with a focus on Greece. Her organization, Insight Collaborative, has partnered with other organizations in Lebanon and Chios to promote systems of aid delivery that focus on restoring the autonomy of the affected population. Insight's primary focus is on advocacy and encouraging a new movement in the humanitarian field where the displaced population are seen as active participants in their circumstance rather than passive beneficiaries. Madi's personal focus areas are mental health, public health, and population health, and the design and implementation of humanitarian interventions that involve the affected population. Welcome, Madi, to our webinar. So, can we hear Madi? Madi, yeah.
There we go. I'm unmuted. Hi, thank you for having me.
Welcome. And so I will let you two start, and you have about 5 to 7 minutes each of you, and then we will go on with the questions that Galia prepared for us.
Wonderful. All right, can everyone see my screen okay?
Yes, ma'am.
All right. All right, so Madi and I really want to just take the time to speak with you all. Again, just to give a general foundation, general context as to the situation for refugees, asylees, and internally displaced persons, or IDPs, and what the situation really means for them, even before the COVID outbreak. We were talking about the camp situations, but also in urban settings, and the really importance, we can't stress enough, of advocacy in this time. And Madi will go into the context of the situations more in depth in the camps, and with her, incredible background of healthcare and aid delivery during, acute humanitarian crises. I just first wanted to share a picture of dear Madi and I. This is us 4 years ago, first meeting in northern Greece, in Edomini, Thessaloniki, where there was a large population of, I should say, asylum seekers looking for refuge after crossing over the Mediterranean. You hear about the hotspots, the islands of Greece, but there's still, and to this day, even 4 years ago, or 4 years today, there's still a big need for support for refugees that made it onto the mainland. This is a picture I took about around this time, also giving you an idea of the context Madi is going to go into. Just the idea of proximity that individuals, that families have, in terms of being on the margins of society. This is nothing new for refugees and asylum seekers in terms of being in exile, in terms of being, in a sense, isolated from individuals virtually and physically. And, luckily with technology and social media, we can have a sense of community in a very visual way. But unfortunately, individuals who are in overcrowded conditions, without the protection and recognition of the state in a condition like this, it's going to be almost nearly impossible, if an outbreak were to happen, to contain it without the proper, the measures in place. So just to briefly give a quick context, for those of you who may or may know or are well versed in these issues, right now there are about 70 million forcibly displaced persons. Even in just in the last decade, displacement from anything from persecution, generalized violence, and conflict has increased over 50%. If you think about also where these communities are located, they're generally speaking in countries that don't have the resources, the capacity, the infrastructure to take large volumes of asylum seekers. So again, we kind of talk about also what you see maybe in the media, but the numbers that, let's say, are coming to the US or in the EU really pales in comparison to areas in the Middle East and North African region. And just to also understand the scale of this, every day there are about 44,000 individuals who are forced to flee their homes. When you think about that, half the world's refugee population spends at least on average 4 years in a host country without the proper integration into society, you know, in terms of just basic accommodation, security, protection, let alone basic necessities, you're going to have a very struggling, marginalized population, and not just understanding public health measures, but actually being able to obtain the resources and the support that they need. And one context I want to give in particular that goes with my background is the context of Syria. Someone that Madi and I know very well, an individual we met in Greece, a Syrian named Abdulaziz. Abdulaziz mentioned that in comparison to the outbreak of COVID, if there are 500,000 deaths from the Syrian humanitarian you know, war and violence, if you break it down into the 9 years of the revolution, that would be about 152 deaths per day. So if this were to escalate in predominantly Syrian, heavily populated Syrian refugee and asylee communities, it could potentially kill more people in 1 month than this ongoing violence inside Syria has killed in the past 9 years, which is an extraordinary and horrible thing to think about in itself in terms of just the sheer scale. And most recently in northern Syria on the border of Turkey and Idlib, where we've had just recently, you know, 900,000 in February, and then most recently in March, another 100,000 being confined into the most densely populated region in the Middle East right now. It would not be able to contain an outbreak of the pandemic that we're currently seeing in other parts of the country. In Idlib alone, there are about roughly 1.4 doctors for every 10,000 people. So this could have huge impact in a region that's very vulnerable, but also very much isolated without the protection of course, the state that it's currently in and facing those horrors, let alone this invisible pandemic. When you think about just the generalized vulnerability, I know I touched a little bit upon this, but, and Galia did mention, and Denise, you're confined to of course, borders, no mobility in itself, but in very makeshift conditions. In urban communities where over 90% of Syrian refugees are, it's abandoned warehouses and buildings, and very unhygienic, you know, situations. And I want to quickly mention that things that you see on the global component could cross over in the US and vice versa. We're seeing a major halt in immigration services. So in Greece alone, they've stopped admitting asylum cases, and there's still a very broken system that is the common European asylum system. So if that was broken before, imagine now with the need to quickly, you know, isolate and distance individuals and provide the proper care and support they need if they're not already connected to the proper services they need. One thing I do want to quickly highlight on this list is Ramadan. So people within the faith I practice, in about a month, they're going to be fasting from sunrise to sunset without water, without food, and potentially having pre-existing conditions. So imagine when, you know, when the WHO is saying, you know, to constantly wash your hands, to, you know, be drinking water, to boost your immune system, things like that. That's not possible for a very vulnerable population in itself. And, you know, Madi and I will go into what the needs are and how we can address this. But, you know, a sense of community, you know, a sense of, you know, a more accommodating space and access and opportunity is how we're gonna have, you know, an effective approach. And the only way this is gonna be an effective approach is if it's inclusive to those even on the margins of society. And I'll quickly just go through a few pictures. This is Atma Cap at the Turkish border in northern Syria. if you can just see how close in proximity individuals are, on the next slide, even just being able to access water for bathing and regular water usage, or dealing with water contamination, it's just it's just going to be a very difficult thing to tackle. So I know later in the series we'll talk about families resettled in the US. The lucky less than 1% that do get resettled, access and recognition is just so critical. And I was really astonished to see that there were even reports in the US where immigrants were afraid to even go to the hospital or be able to say, I have certain symptoms, not only from the stigma and fear of being scapegoated and blamed for a spread, but the fear of what it would mean to their path to citizenship. And there has been talks before with the administration that access to public benefits could alter the path to citizenship. So we really have to think about this fear that is unfortunately installed in our refugee and Israeli communities globally. The number, I'm not a public health expert, but the number one thing to address in this era of social distancing and COVID is we need to build trust. And if you have a significant community in the world that is already, physically vulnerable, already detached from, mainstream medical communities, the ability for this and other transferable diseases, it's not going to be able to be combated without the trust in the community. So we need to look, in terms of advocacy in this time. We have to think about the 70 million that can't, hashtag stay home. We have to think about shifting the narrative and the stigma of our communities, our at-risk communities, and also the underlying, trauma and existing, terrors that these communities face on a day-by-day basis. And we really need to come together in connectivity with, other like-minded individuals or organizations, which Madi will share. It's just a very critical time that, just because we might not see the symptoms, just because, we might not be, visually understanding the impact in these communities just yet, just from the research and from talking to individuals on the ground, there is fear, and I wouldn't say number one, but a big component of that is the stigma and the fear of being blamed or scapegoated. So I know I went through that kind of quickly, but I definitely want to make sure that my dear friend Madi gets on and she can really talk about the work being done by her nonprofit Insight Collaborative, and just understanding what this really means in depth in the camp setting. So
thank you, Lina. I will quickly turn it over to Madi, and then we will switch to questions.
All right, let me get onto the right slide here. Thank you, Lina, that was actually quite in-depth and informative. View, present. Sorry, I'm not the tech person. I can start IVs. That's more my scope. Technical support is not. Okay, so real quick, I just want to give you guys a little bit of context for what these camps are like for those of you who have not gone and experienced a humanitarian crisis firsthand before. First and foremost, I can't emphasize this enough. Pictures and videos will never do this justice. It's a very, understandably, a very complex situation. There's many, many factors at play, especially in a place like the Greek islands, where you have this conglomeration of people from all over the world, really, coming and trying to seek safety in Europe. So what in the humanitarian field, since I do tend to focus on healthcare delivery and humanitarian aid delivery and how they relate to each other, we have 4 primary areas that we always look at, and we understand that these all have an interdependency that's important for us to understand. So obviously the health of your population. We need to know how healthy or how at risk and vulnerable people are so that we can prioritize our interventions correctly. We have to understand our aid delivery. We have to come up with strategies for distribution. We have to understand our supply chain very well so that we know what kind of aid we can secure and how we're going to be doing that. We have to focus on the lived environment. This is important for us so that we can, we can prioritize our interventions easier, but the context is just so key because the context is going to influence the behavior. Like, this is very much a social science. It's important for us to take human behavior into consideration, even with things that seem cut and dry like logistics or medicine. And then lastly, we have to look at the legal and the political situation. There are upstream issues that are going to influence this. We have to understand where people are coming from and why we're leaving. We have to understand what's ahead for them. And we also have to understand like the laws and policies within how we practice as aid workers or medical practitioners. It's important for us to be clear on that so that we don't get in trouble. And then real quick too, the baseline health concerns that we have. Essentially, a refugee population with some exceptions, they're going to have the same healthcare problems that the general population has. This is something that a lot of people seem to forget. We're dealing with diabetes, thyroid problems, epilepsy, these more chronic or congenital conditions that we would see in the regular population with about the same prevalence. The difference being access to medications, emergency services. This is all really difficult for us to obtain. Poor sanitation. The sanitation and just the compactness of these environments means that communicable diseases, parasitic infections, fungal infections, these are much more common. And so any sort of illness that someone obtains, it's going to be exacerbated by these extra vulnerabilities. Additionally, as it relates to coronavirus, as Lina said, the World Health Organization and the CDC have put out these recommendations that say like, oh, you should drink a lot of water, you should distance yourself. This is impossible in a camp setting like this. And I think something that brings it to light is like, just think about right now, if you're stuck at home, like maybe with your family or with your spouse, and you have one bathroom, trying to share that one bathroom with like 2 to 4 people is really annoying. Try sharing that one bathroom with like 100 other people. We see a huge amount of UTIs because people just don't hydrate because they don't want to go to the bathroom. And that is also a huge problem if you're trying to keep your immune system robust. Additionally, as far as like the pulmonary stuff too, people have to use fires, hot water, and oil heaters as their only heat source. And so this actually causes some pretty serious respiratory complications and respiratory problems, which is an issue when we're looking at a condition like COVID that seems to target the respiratory tract when it's exacerbated. Refugees understandably have mental health. Mental health problems. I don't think we need to go into much detail about that. It's perfectly understandable. But another thing that people seem to forget is that people aren't just coming from trauma. All along the way, they are subjected to horrendously traumatic experiences. And in the camps themselves, just because they've reached, quote, safety, it doesn't mean that they are free from continuing to experience trauma. And that in the future, as they are put into these new communities and trying to assimilate, that they won't then experience more trauma later on down the road. Mental health services in these environments are very difficult to establish for a lot of reasons. That could be a whole separate webinar on its own. I've put all of my speaker notes into the PowerPoint so that you guys have access to those. And if anyone has questions, feel free to contact me on any platform. But basically what I want you to understand is that the mental health services that we would think of as appropriate, like especially in Western cultures where there is more of a movement towards focusing on mental health, those are not available. And their mental health also has very strong cultural and spiritual ties that mean everyone's perception of mental health and everyone's acceptance to assistance with mental health conditions is going to be different, which is another reason why these services are typically not established, nor are they super effective when they are. I'll also discuss real quick our system of aid delivery. So I work with an organization called Refugee Biryani and Bananas. They partner with my organization Insight Collaborative, and our main focus with our aid delivery is that we want to fill the gaps. So we go in and we identify where there is a lack of aid. In our case, our most recent campaign has been delivering aid to the men of camps because the men are typically underserved. And we make sure that we do this in an equitable way. So we've developed a ticketing system to ensure that people have equal opportunity, where we go into the camp and distribute tickets. We have a computerized registration system. But all in all, with our distributions, there's no possibility for social distancing when it comes to distributing. We also include the affected population. This is something that's quite important for us because ultimately they are the experts of their own circumstance. It doesn't matter how much time I go and spend in a refugee camp. It's not my reality, and it's really not my place to be telling people what's best for them. So just an idea, these are what our distributions look like. We have the boys in camp help us sort and ticket. And then the lived environment, Lina touched up on this, but as far as the camp that I focus on most right now, Vial is home to around 7,000 people, give or take a little. The official number from UNHCR is over 5,000, but there's a lot of people that come through and don't actually necessarily register and are living there. This camp was designed to hold around 1,100 people. So like I said, imagine taking your bathroom that you're trying to share with like 1 to 4 people and try sharing that with 100 people. The sanitation is a disaster. The shelters are also quite flimsy and unstable. And so any of the weather conditions that we see this time of year can really be disastrous to people's living conditions. So our special considerations with COVID. Obviously, our main concern is the speed at which this will spread in these overcrowded spaces. People are living super close together, and the opportunity for hygiene, people know what to do. Another misconception that I hear a lot about refugee populations is people seem to assume that they're uneducated. Not everyone, but it is kind of a common trend that people will be surprised when I say like, yeah, my friend who's a lawyer, my friend who's a doctor, they're coming from backgrounds with very good education. They understand what needs to happen. It's just impossible to maintain these recommendations in this environment. Something else though that we need to consider is that people who are displaced from conflict zones have other issues. Mobility issues are going to be huge when you're dealing with any sort of condition that impacts pulmonary function. People have paralytic problems from injuries. They might be missing limbs. So even CDC guidelines like maintaining 30 to 40 minutes of cardiovascular exercise is impossible for some people, and that adds an extra level of vulnerability. A lot of the kids, like the Syrian conflict, for example, has been going on for 9 years. Some people haven't had access to vaccines. So that's another level of vulnerability, is that they're not protected against other communicable diseases in addition to COVID-19. And lastly, our supply chain has been interrupted. And this is a really big deal. As the whole world goes into lockdown, the camps are no exception. Regular aid delivery is not possible. So people are now going to experience food insecurity. They're not going to have enough supplies to maintain basic sanitary recommendations. And the other concern that I have as someone who focuses on the actual delivery from shipping container to the camp is that when people reach this point of resource scarcity, it's very difficult for us to distribute in a way that is safe and equitable because of that desperation. So yeah, as I said, the disruption of our supply chain is really concerning. Also, we've had to reallocate a lot of our funds that we were planning on using for other things to sanitation and food. And so this disrupts our fundraising efforts as well and kind of forces us to reevaluate how we want to do this. Something else that people don't really consider, if you can't leave the camp to go and refill your phone card, you can't communicate with people. We've had a break in communication with some of our boys in the camp, and that makes it difficult for us to plan aid delivery and to make sure that their needs are being met. As far as mental health considerations with COVID, so the social isolation, people can't go refill their phone cards. They might not be able to communicate with their friends and family. This is really distressing for people. They're also being told to stay in their shelters, and so they can't move freely around the camp to talk with their friends. When you're in an environment where people are so prone to mental health problems like loneliness and anxiety and depression, that social interaction can be what saves them. And now they're cut off completely from that. Like I said, communicating with family, that's a really big deal. As Lina mentioned, the immigration services have been halted tentatively until April 10th, but I have a feeling they're going to reevaluate and extend that because it is not safe for people to be interacting yet. But this, people have been waiting, some people have been waiting over a year for these interviews, for these decisions, and now they're being told to wait even longer, potentially indefinitely. That has a huge impact on people's mental health. We've had a huge spike in anxiety, in depression, and in people just generally expressing some pretty severe distress about this. And all in all, this is a very scary time to be alive. We have this virus that lots of the public, I think there is a lot of information about it, but it's hard to know who to listen to, because the CDC, at least here as a practitioner in the US, the CDC is changing their guidelines for us, for healthcare providers, regularly, saying like, oh, you should do this, but now it's okay if you do this, and a surgical mask is fine, but it should really be an N95. I mean, imagine the amount of fear that you have when you're living in a situation where you know refugees know that they're at the bottom of the food chain. It's no secret. The reality of those camps speaks for itself, that the rest of the world is not super interested in pumping resources into helping them. They know that. And so they understand the additional vulnerabilities that they have, and that causes a lot of anxiety for them. And like I mentioned, the conditions are terrible. This is one of the bathrooms in the Vial camp. I hope you guys can see that okay, because my screen chat box has moved over to the side a little bit. But yeah, lack of access to food. Ramadan is coming up. All of this can play a part in weakening the immune system. The flu is really bad this year, and it was sweeping through when I was there in February. So people might also be getting other viral illnesses or recovering from them. That can weaken the immune system. And then, as I mentioned too, some people have regular exercise regimens and they are not able to maintain them because of the lockdown. So all of our information is here. I'm going to stop this screen share so that Denise can do the questions.
Okay, thank you both so much for these in-depth and thorough talks, and you covered a lot. But I still will ask the questions that Galia prepared for us. In the meantime, please, we can have questions from the audience. You can type them in the chat box. And we have about 2 minutes for each question for the moderated questions, and then we will turn to the Q&A. Madi, I want to start by asking you, how do you conceptualize the refugee crisis and the people you are working with on the ground?
I think that first and foremost, what helps people gain a deeper understanding of this is looking at, we have upstream problems, we have downstream problems, and then we have the actual humanitarian crisis. These crisis zones and all of the issues that contribute to them are very complicated, but I think that just acceptance of that understanding that these are human beings who are coming from really powerful stories and they are walking into very powerful stories, that's the most important thing that we can do, because that's what kind of gives you the motivation and the emotional investment in understanding, in wanting to understand more about these issues and wanting to help people that the rest of the world can sometimes ignore.
Thank you. And this next question is for both Madi and Lina. What are the greatest needs currently? You both addressed some of them, but could you repeat and elaborate a little more on that?
Go ahead, Lina.
I was going to say you, Madi, but I mean, even the greatest needs, I mean, Madi was saying for a lot of the conditions that we're seeing, you know, even before the, you know, the onset of just, you know, protection and shelter, what are we going to do with proper accommodation that normally would be provided by a government, you know, if you're considered a citizen of the state? And obviously, of course, the you know, access to water, food, and supplies and psychosocial support more than ever. You know, I hate to say if you know, it's a little too late, but like Madi has said, you know, these are things that should, you know, were, you know, should have been addressed for years and years. There are a lot of underlying things, and although, you know, we can't go back in time moving forward, we need to find a solution also within the community, and not just, you know, handing out leaflets. We need to ask, you know, what do they also see in terms of intervention and aid? And I also think about families and individuals. I briefly mentioned overcrowded outside the camps who normally do not get access to aid delivery. What does that mean in terms of being recognized by the state? You know, when you're thinking about this issue in public health. It's a human rights issue, and we need to also think about how we're going to safely, you know, accommodate individuals and families who, you know, cannot go home or do not have the means to a proper means of, you know, security and protection. I don't know, Maddie, if you have something to say as well. So
I mean, as far as the delivery, that's really what needs to be done. But in order to do that, we need money. I never wanted to be one of those aid workers that's like, we need money. But really, truly, we face so many barriers in aid delivery that in a situation like this, I don't want funding to be one of them. I don't want to have to be able to say like, well, we could have gotten you bleach if only we had the money. No is an answer that I have to give far too often in my line of work. Not only is it really demoralizing for those of us on the front lines, but it's frustrating because that no means so much more. Like, it's not just, no, we can't do that. Like, it's perfectly possible. There's bleach, it exists. It's no, we don't have the funding because we just can't rally the funds to do it. So I know that with the current state of the economy, like donating might not be something that's within people's capacity, but now more than ever, we really do need funding so that we have the freedom and the flexibility to provide the things that are needed to respond to this appropriately.
Thank you both for these wonderful answers. My next question is about a piece of news that came out just today about an initiative by the Berlin state government to bring in the most vulnerable. German activists have collected funds to start airlifting refugees and asylum seekers from the Greek islands to Berlin. Axel Steyer of the German NGO Mission Lifeline says that they collected 55,000 euros to cover flights. German church-affiliated charity organizations have agreed to help when it comes to housing of the new arrivals. So in light of this new development, what do you think about this initiative, and should we have more initiatives of this kind, and what are the best ways people can support the refugees in Greece short of chartering flights?
Do you want me to take that one?
Yeah, you got this.
In reading that article, I had lots of questions. The first one would be, my main concern with this entire disruption in the asylum process is that people's case information is going to be lost. And so moving someone to a different country, like, yes, all of this is theoretically done under UNHCR and under the European Union, but my biggest concern would be that certain people with certain vulnerabilities are going to fall through the cracks if we start doing that. However, these are people's lives. There were 2 confirmed cases on Chios in the Greek population yesterday, and that invoked a visceral terror in me that, like, these camps, people become my family. Like, we spend time in these camps. Lina can attest to this. We spend extensive time with these people, and even if there's language barriers, cultural differences, you name it, they become our family. And so ultimately, I think that decongesting these camps, that's the word that's been used, not necessarily evacuating them completely, but decongestion would absolutely be a huge help. That would address a lot of the issues that we were talking about. It would reduce the load on sanitation and medical services. It would reduce the amount of funding that organizations would need to supply the whole camp. And most of all, that resource scarcity could be reduced if enough people are evacuated. But it's a lot more complicated than just pulling people out. I mean, a lot of these people, especially, it was talking about the unaccompanied minors as being particularly vulnerable. Most unaccompanied minors that I work with who come through are actually seeking reunification with family members who are elsewhere in the European Union or in the US and Canada. And if that service is disrupted and if their cases are dropped and for whatever reason they're not reunified with family members, that could be absolutely detrimental to the rest of their lives. They could also be bringing communicable diseases. That's a very genuine concern, that with the long incubation period of COVID, they would have to be isolated then in Germany, which then just begs the question, are we simply taking a chunk of the problem and moving it somewhere else? So that's kind of, I have more questions than solid thoughts with that issue, but that's kind of what went through my head as I was reading that.
Okay. Lina, would you want to respond to that?
No, really just, I mean, I guess just to quickly echo what Maddie's, saying is that, this virus is not limited to borders. We've seen border closings, but that alone is not going to be enough. And yes, in theory, like Madi said, the idea, if it's possible, I mean, it would be great, because for years and years, the EU, unfortunately, using refugees as political pawns, have gone back and forth in terms of having a shared, coordinated effort to support individuals, and we still see that, even with the EU and Turkey, but with this broken, asylum system, unfortunately, still refugees the support will still be, not a priority. And although it shows that this initiative would show a more shared responsibility and effort, we still have to think about, like Madi is saying, what might be, might be taking place within individuals and families before this. And this article is just talking about the islands, let alone the Greek mainland.
Yeah.
Now on the islands, and Madi knows a lot more in depth. Let's say the island of Lesbos, which constantly gets talked about as a hotspot. That is about 20,000 people living in a space meant for just under 3,000. So you have to think about what the conditions were, and uprooting individuals. I mean, we do need efforts to address the space and accommodation and protection, because that is lacking. But we have to think about, on another scale, what that means for the systems in place, and what that would also mean in Germany as well. So
unintended consequences are a big concern with that proposed idea.
Yeah, we hear you. So there are several questions from the audience, so I'll switch now to those. One set of questions is about the information, how information circulates. One question, so I'll ask these questions together and you can answer them in whatever way you please. Where do you get your information regarding the Syrian refugee statistics and other news in general, and in particular in Greece and Lebanon? And another one is about information, is the information that refugees can get about their surroundings. Do you use, or are you familiar with any mobile mobile phone apps or sites with information for refugees regarding COVID-19? And where do you see the potential in ICT in this situation?
Do you want me to start with those, Lina?
Sure, yeah.
Okay. So from the healthcare practitioner point of view, all of the major medical bodies provide their informational leaflets in like every language. So what we've been doing, I work with a settlement in Lebanon as well, and they don't have an NGO that comes in and does medical care. So what we did is we downloaded all of the leaflets in Arabic and passed it off to our community liaisons to hand out, and said, let us know if you have any questions. And in that situation, that was fine. They're isolated, there's no suspected cases, that's fine and dandy. In the Greek island camps, it's a little more complicated, but the medical organizations there have downloaded all of the material, all of the educational material in the appropriate languages, and they post it on the news bulletins in the camp. So that, we usually tell people that that's the best way to get the information, is what's posted on the bulletin, because the Greek ministry does a really good job making sure that the information is available at these information points. Additionally, and Facebook misinformation is something that plagues every society that has access to the web. People are getting a lot of their information from Facebook. And so we try our best to promote really good sources. Like the World Health Organization is great. The only issue with that is that there is quite a bit of cynicism, which is absolutely fair, in saying like, okay, they're saying wash our hands, they're saying practice good hygiene and exercise, but we can't do that. So as far as people getting the most up-to-date evidence-based information, they have the same access to the resources that we do. It's translated into all of the languages, news outlets, governing bodies, it's all there for them. There's a couple of apps I haven't actually looked at as far as Corona goes, but there's some that help people find information on things like medical services and other aid resources. And I'll respond to all of these questions individually as well, so that people, even if we don't get to them in this, so that people still have their answers. And then as far as the first question was about our access to information. Is that correct? Some clarity on that, like as aid workers? Okay.
Yeah. About Syrian refugees in general, and in particular Greece and Lebanon.
Yeah. So as far as numbers go, that we typically get from UNHCR. Lina, you got the numbers that you used in your presentation from UNHCR, right? On your slides?
From like a variety of different sources, UNHCR being one of them, of course. But I also looked a lot of other, maybe on the smaller scale, NGOs, civil society organizations, especially that are specifically focused on Syria, or research think tanks like Migration Policy Institute, you know, Human Rights Watch. IOM, especially in terms of the scale and the numbers that are, you know, more or less being updated as frequently as they can be. So
yeah. And then as far as for us on the ground, it is hard to keep track of actual numbers. The UNHCR databases are usually a couple of months behind, depending on where, which context you're looking at. People also kind of come and go independently. Usually arrival numbers are very accurate, but as far as transfer numbers from the Greek islands, we really have no idea how many people are coming and going. Some people have freedom of movement within Greece, some do not. Some leave illegally and it's not documented, so those numbers are a little harder for us to get. So it's usually educated estimations based on who's actually trackable.
Okay, thank you. So the last set of questions that I will bring together is about the larger question, or rotates around the larger question of how can we help. One of our participants asked, seeing though many of us have never visited or experienced the trauma of refugees, what are some of appropriate supports or words we can say to our refugee clients who have resettled in our communities? We want to be of support, and only being able to provide telebehavioral health is limiting. The second question of this order is, do you guys know any volunteer or internship opportunities in your organizations or other NGOs to suggest? And which organizations or projects would you recommend us to donate to?
Okay, that first question was a really good one. Props to whoever asked that. So something to keep in mind when you're working with a refugee population, when people are telling you their story, they're reliving a trauma. So it seems for us, it seems very intuitive to say like, oh, tell me your story so that I know where you're coming from. That can actually be really harmful for people. And so what I've taken to doing, if people start telling me their story, of course I listen, but I try not to ask anymore. And I've been reading a lot of books that are written by refugees. There's a couple of really good ones that are on all of our social media. And I think at the bottom, no, it was in a different presentation. I can send out my recommended reading list, but I think that getting to sort of experience someone's journey in depth by reading a book that talks about it, that's a really good way where you can learn how to not just sympathize with the situation and saying like, oh, I can see how this would be difficult for you, but to actually empathize, like getting pulled into these stories in a way that you can feel their pain, and you can sort of come, obviously it's not the same as living it, but you come to a better understanding. And it can be much less damaging than asking someone directly for their story and having them relive that trauma. As far as working with organizations, volunteering with organizations, I can also send out a couple of resources about that. If people want to volunteer on the ground, there's some really cool, they almost work like matchmaking, travel, I don't know, it's like a combination of a dating app and a travel company where you can sort of say like, here's my CV, here's what I'm interested in, and they will match you with organizations who are looking for volunteers within that capacity. And at Insight, we're always looking for people to help us with advocacy. We do a lot of different writing projects. We're going to be doing a couple of webinar series, like getting people to tell their friends about webinars like this, getting people informed. That's really the best thing that you can do. And it's at this point too, when all of us can't really go anywhere and do anything, it's the easiest thing that we can do as well. And Lena,
Yeah.
you can there.
No, I mean, that's great, Maddie. Obviously, insight. And it feels like in a lot of ways, just in our day-to-day, we feel like a bit overwhelmed about what we can do just for ourselves and for other individuals. But really, it sounds very simple, but it can be in terms of advocacy. And just kind of going off of what Maddie has said, unfortunately, whether it's a Syrian or someone from Afghanistan or someone from Yemen, a tie to a certain nationality or immigration status has definitely been stigmatized, and they would be, unfortunately, the first to be accused of spreading something like this if this were to erupt. So let's change the conversation. Let's having it in a very more humane and dignified way. And I can, attest to Maddie and Insight that they definitely do that in terms of not just being, giving tools, but giving tools in ways that encourages people to use them and makes them feel like they're part of the process. I can say from firsthand experiences, whether working with individuals and families here in the US or overseas, a main thing is that, okay, you might be there to listen, but then you kind of go away and run with the info and then don't come back. So it feels like you're just taking information without anything in return. So really, when we say, if you develop these relationships, go and volunteer, make sure you have that kind of long-term impact. And if you're going to make those relationships, build those relationships that organizations like Insight are doing. So it shows, we hear about a lot of authenticity and accountability. I mean, these buzzwords are great and all, but if not implemented and keeping in mind you're working with, not just working for, then you will be able to gain a much deeper sense of trust in the community. And that's when you're going to be able to address, public health messages or finding an inclusive approach to COVID, because unfortunately, it's of course a big factor of access, but a major thing is the fear and the mistrust. And we have to work towards building that trust again within our communities and actually listening. So not just talking to hearing, but actually listening to our communities, sharing with our friends and family. In terms of organizations, besides Insight, I mean, I coordinate and, work with a lot of different organizations, which I'm proud of. There's the Karam Foundation here in the US and Turkey, working for long-term stability for youth, with such a large generation of Syrian youth in the diaspora. That's going to be also key. Locally too, there's a Syrian Community Network. There's a lot of different organizations, especially grassroots in nature, that are working in coordination and solidarity, and hopefully we see that mirrored in state responses in terms of how we're going to be working with individuals, whether in the US or outside, that unfortunately are not protected by the state. And even if they are, we have to ensure that that's really communicated well with our communities. So.
Okay, great, thank you. I am receiving from messages from my co-organizers saying there's great questions, and I'm seeing them on the chat too, in the chat. So we will extend the webinar 10 to 15 minutes so that you have the chance to respond to these questions. But before we go into those questions, I would like to thank everyone who joined us who have time until noon only today. And I would like to remind them we will be hosting these webinar series every Wednesday, and we will be starting at 11:15 instead of 11 from now on. So follow us on Facebook if you need to go now, and we will be posting our webinar series going forward. So the next question we have is about Portugal. And they say the question is, Portugal has currently decided to treat the migrants and asylum seekers as permanent residents so that they can access public health care services. Would this be a good replicable initiative in other countries? I know in Lebanon this may not be an option because the health system is already overstretched to manage the COVID pandemic.
Yeah, I'll quickly start, and I'm sure Maddie, you have some things to probably say about that. I did see that within Portugal, which is, a good, step in the right direction, because a ban on, let's say, asylum or halting services or processing applications could endanger a lot of lives and further jeopardize public health in terms of lack of shelter and care. From my understanding, this would go until about July. So depending on what happens with the course of COVID, it could be great in terms of flattening the curve. I can't say on other states, like you mentioned, some states, not just failed states, but with states with very weak or overused, resources and capacity, like Lebanon, who has hosted a lot of refugees, that would definitely need the solidarity of other states, such as, member states in the EU. So if we have to look at this, I still can't imagine it being an isolated, concept and issue. It has to be one that is done with the support and recognition also of other states. I don't know if you have anything else to say on that, Maddie.
Yeah, I mean, basically, the thing that concerns me the most as a healthcare provider in general is that this virus is spreading so quickly. As Lina said, it crosses borders quite easily. The incubation period is very long. This is something that even in the most ideal healthcare circumstances is very difficult to deal with. So I think that the entire world should really be paying attention. Greece was actually recently praised for their response to this virus. All things considered, they don't have tons of money in their healthcare system, but the way that they've handled this has been fabulous. So if that kind of solution, like systems solutions, is something that interests you, Greece is a great model to look at the moment. But I do think that it's important that health systems everywhere, not just as it relates to refugees, but as it relates to vulnerable people, like homeless people, they also live in crowded spaces. They don't have access to good sanitation. There are vulnerable populations everywhere, and all of the systems, I think, should look to Portugal as an example in saying, how do we treat vulnerable people well and protect them? Because not only is this a public health issue at this point, but because that's just the right thing to do.
There's another question related to that. Hello from Hong Kong. Here we do not have refugee camps. However, we do have thousands of asylum seekers who are prohibited from working and are reliant on a limited assistance to survive. The pandemic has aggravated their predicament. Utilities are in a skyrocketing price. Government refuses to increase the assistance. Some supporting organizations are closed. From your professional experiences, do you have any recommendations? What can citizens do to ameliorate the situation?
Fantastic question. My honest answer is the world has not seen a pandemic of this magnitude before. Yes, we've had other infectious disease outbreaks fairly recently that have catastrophic consequences like this. But we've really never seen something of this magnitude in our lifetimes. So I think that something that at Insight we really believe, and in all of the contexts I work in, actually, we really believe, we have to be imaginative in the way that we think. One of the biggest obstacles of working with large NGOs or government organizations is that there's still a lot of bureaucracy and there's a lot of red tape that prohibits us from getting things done in emergency circumstances like this. And so I think that my honest advice to that would be get creative. You need to get creative. I don't know the context well enough to have any more advice than that. But I know that, yeah, here in Washington State, small organizations, NGOs, charity groups, we're just having to get really creative, really flexible, put our heads together and say, what can we do with what we have? We can't look at this issue as saying like, okay, here are all of our limitations. That's a given. We have a lot of limitations right now, but we have to kind of flip that and say, all right, well, what do we have to work with and what can we do with it? So that would be my advice. Get really creative and don't be afraid to like try something and fail as long as the failure is safe. Don't be afraid to try and be like, okay, that didn't work. Let's try something else. That's like basically what I do for a living. So it's totally fine.
Lina, would you want to respond to that?
It's just really, I mean, Madi said it very well in terms of, you know, getting creative. We're seeing also a lot of people even in the private sector that are doing different initiatives to combat, you know, at-risk and vulnerable communities here in the States. And it's just more or less making sure that the communities that we're talking about here are also part of these efforts, no matter how small. You know, again, we have social media and technology for a reason, that things can have a ripple effect, and we shouldn't be afraid of having that impact, you know, no matter what it is. So.
Okay, I think this will be our final question, and this is about the level of preparedness and what planning is being done to the best of your knowledge. After observing the near riots at the toilet paper aisle at Costco, the threat to the mental, social, and physical health of 70 million displaced people is beyond my comprehension. With all the work being done by you and other NGOs, the death rate in the refugee environments is going to be horrific. What planning is being done to deal with the post-pandemic chaos? Excellent question.
Yeah, wow.
I can really only speak to what we're doing in Chios and in Lebanon. So we have kind of a multifaceted approach. One of our trains of thought is the show must go on. So we are keeping our projects that we were planning on implementing. In Lebanon, we have a Ramadan project. In Chios, we had a project that we were planning on helping with for Ramadan. We're still very much planning on executing those, just with it at the back of our minds that it might not be possible, but we want to have the plan in place just in case a miracle happens and it is possible. But a lot of what we're focusing on now is I'm trying to find a good way to phrase this, like essentially community recovery. We're watching very closely about what the policy repercussions are going to be with this. Like probably one of the biggest obstacles that is going to prevent us from navigating this in an effective way is the lockdowns. It's going to be very difficult for us to access the populations to stage any sort of intervention. And so we are conscientious. As mentioned, like the toilet paper riots, resource scarcity, perceived or actual, does things to people. So as far as our distributions go, we're planning on including many more volunteers, international volunteers, to help us with the distributions, because there will be an increased level of risk because people will not have received anything for so long. So that's kind of where we're at now. All of this was tipped on its head a little bit yesterday when we found out that there were confirmed cases in Chios. I was hoping that the island-wide lockdown would help prevent that, but unfortunately it has not. So initially we were planning the show must go on was like 70% of the plan. Now that's moved down to about 40% of the plan, and 60% is, okay, well now how do we shift our focus for handling this pandemic? So to answer that question, yeah, we're kind of like a multifaceted, we're like, let's hope for the best and have a plan for that. But now it looks like we're moving towards worst case scenario. How do we plan on dealing with that, but then having these other plans in place for once this is over, we can still continue with our regular work.
Yeah.
Lina, would you want to add anything?
No, I think Madi
covered
it all. She nailed it. Yeah.
Am I going to be able to respond to these questions after the chat ends?
Okay, great. That's wonderful news. Because I don't want to go too much over time. So thank you so much for these wonderful talks, presentations, and I would like to thank also our participants for these great questions. which enabled this thorough discussion. And unfortunately, this is all the time we have for questions today.
Denise,
I will ask Lina, Madi, do you have any final words? And after your final words, I'll turn it over to Galia to conclude our webinar today.
Go ahead, Lina.
No, I want to thank everyone again, and for the lovely organizers and the work that Madi and individuals are doing from small to large scale. It can be done, and we still can address these issues. And you definitely all have a role to play. Again, no matter how small, and just to think about just the context. You hear about the scale of humanitarian crises and the vulnerability of refugees, IDPs, asylees. That might not be something new, but just think about again, what they have fled from, or what they are currently still facing if they are still within failed states like Syria, and just having that a notion that they do have a place and can be a priority in not just global peace solutions, but addressing these global public health concerns. There is a lot to be done, but we have to also stay optimistic and definitely be inclusive in the response. So
yeah, and I will echo in thanking everyone for participating. Like, it's super cool that you would take time out of your day to come and listen, and to be informed advocates, and that all of the faculty would take times out of their schedules to make this possible. That's just really fantastic. But yeah, I think that what this global pandemic is showing us is that there is time for a shift, like in the narrative and how we're addressing this. We need better solutions than this. We're seeing healthcare systems that were considered some of the best in the world simply collapsing. We're seeing the global economy coming undone. We're seeing really vulnerable populations of people being left behind. This shows that we need to change the way that we do this. So that would be my takeaway message that I hope everyone has, is like, yes, it's possible, but at this point it's like really necessary, and we need to work a little harder to prioritize that.
yeah, I guess the only thing I would want to say to echo off of you, Madi, is that again, we can't think of this like invisible threat confined to a certain set of borders, and we can't think, well, anymore, like if it's does it affect us, or is this even within our own four walls? But it's a global effort, and we can't think of it in isolation that we might have previously. So just wanted to add that into Madi's thoughts as well. So
Thank you. Thank you, Madi and Lina, and thank you, Dennis. And this is Galia. Sorry I couldn't be moderating, but Dennis did a great job. And
looking forward to participating with you all again next week at our upcoming webinar. We've shared links on the side, and so you can contact me with ideas, and then you hopefully can continue to follow us on Facebook. Bye.
Thank you, everybody.
Thank you, everyone. This is it for today's webinar. Madi will be answering the questions in the chat. You said that you have time for that, right?
Yes, I do. Do you want me just to like read them off and answer them, and people who want to stay on the line can stay on the line? Does that work?
Do that.
Perfect.
I asked several of them.
Yeah, these are pretty good. And there's some that are private messaged to me that I will respond to accordingly.